Hello, Dr. Ayub. Today I am going to discuss about the Doppler in the pelvis. So initially I am going to discuss importance of Doppler in the pelvis in GYN, then in obstetrics. Okay, let's go over the outline that I am going to discuss today. First of all, I want to give you the importance that why a Doppler is needed for GYN. So Doppler means what? Doppler is a procedure of application of color on the image to make it duplex. And there is option. Do you want to do the Doppler? Yes, then click the Doppler button. Then all the options will be activated. Why do I need to do the Doppler? Understand that Doppler evaluates the hemodynamics. Hemodynamics in our body. And the hemodynamics is the study of the circulations of the blood while flowing through the blood vessels. So there are some natural phenomenon that helps to move the blood throughout our body. It supply and return. And certain things can happen that can alter the hemodynamics and in a particular area due to the organic condition, and it could be physiological condition, it could be pathological condition. And nowadays the ultrasonography for the GYN and also obstetrics, we are practicing the trans-abdominal ultrasonography through the full bladder. We call it also transvesical, and also endovaginal or internal. Okay, so now endovaginal approach is much better for the GYN practice. And during the first trimester of pregnancy, unbelievable, the ultrasonography is such a valuable modality that we can use to diagnose or to evaluate and to follow up the condition of a patient. Okay, let's see a little more that in Doppler, what actually we do in the Doppler. In the Doppler, we can figure it out that whether there is a presence of flow or not. That means if it is a blood vessels, it's supposed to have the flow. And there are some pathology like a hydrosalpinx. It may look like a blood vessels, but we need to click the color to differentiate it from the hypogastric blood vessels. If it is a blood vessels, there will be flow and color. And if it is a hydrosalpinx, we will not get the color. So that's the way we can differentiate, number one. Number two, we can figure it out that is there a flow and which is the direction of the flow. Which way the flow is going. And is it a high velocity flow or low velocity flow? And also we can figure it out, is it a laminar flow or turbulent flow? So, and is it an artery or the vein? So many things we can figure it out by applying the Doppler during the ultrasonography. Okay, so now In the Doppler, we can also figure it out if an organ is having the high resistance flow or low resistance flow. And if there is a tumor inside the organ and that tumor is having the blood flow, and is it a high resistance or low resistance? That means it can give us information about the impedances. And as we know that some tumor and inflammation can cause the neovascularization, means new blood vessels formations, and the impedance will go down, there will be more blood supply to the organ or in the tumor. So we not only can identify the resistivity index in the artery, we can also figure it out the resistivity index within the parenchyma. So renal parenchymal, hepatic parenchymal, yeah, we can figure it out the parenchymal resistance to the blood flow. Okay, let's see. What are the main purposes we are going to discuss and using the Doppler in the pelvis? For the diagnostic potential, endovaginal color Doppler imaging that improves the image quality. And as you know that endovaginal is much better approach than the transabdominal, because the transducer is a high frequency and the transducer head is close to the organs, cervix, uterus, ovaries, fallopian tube, everything. Okay, so endovaginal color Doppler for diagnosis of lot of diseases that we are going to discuss. Physiologic variation in pregnancy and the menstrual cycle or ovarian cycle. Okay, so physiologic variation. So pregnancy, it is a physiology, it's not a pathology. And we like to see the changes during the pregnancy time, during the menstrual time and the ovarian time. As we know, the pregnancy, we can differentiate the pregnancy in the first trimester, second trimester and third trimester. Okay, and the physiologic changes we can figure it out by applying the Doppler during the first trimester, and that is more important, during the second and third trimester too. Okay, we will discuss in the obstetrics. And expedite the vascular location. Expedite the vascular location means Doppler application can identify the hypovascularity, no vascularity and hypervascularity. And the hypovascularity is due to the lack of blood flow, ischemic changes, partial obstruction, or there might be no flow at all during the complete obstruction. Can we see all those flow condition and the obstruction in the ultrasound? Yes. And hyperfunction, hypervascularity, can we identify the hypervascularity? In which is the condition in which usually we see the vascularity? Hypervascularity we can see in infection and in malignancies. So we can identify a vascular location that is suspicious for bad disease because of it's showing hypervascularity within an organ. So expedite a vascular location. Okay, so that's the way we will use, that is the diagnostic potential. And the second one is a normal pelvic anatomy. In order to understand the normal pelvic anatomy, we might need to see the blood vessels and its relationship with the organs along with the other organs to get the confirmation that this artery is this for this, like a ovarian artery, uterine artery, fallopian artery, cervical artery, okay, and the pelvic artery and veins. So many blood vessels are there, so we might need to see them in order to identify the diagnostic structures. And we can do that in full bladder and without full bladder, that is called endovaginal. Okay, so now with full bladder we call it transabdominal or transvesical, to see the internal iliacs, ovarian artery, external iliac artery and the uterine artery. So these are the artery commonly we can see. External iliac artery usually we see above the inguinal ligament. Okay, and internal iliac artery, ovarian artery, uterine artery we can see right away. Okay, during the pelvic examination there is a protocol, we can see those arteries very easily. And endovaginal ultrasonography, also we can see the internal iliac artery vessels, and that iliac vessels is a artery and vein, external iliac, internal iliac and the vein we can see. And we can see the ovarian artery, and in the ovarian artery we can figure it out, is it a low impedance and the high impedance. So we will discuss all those things, in which condition we will see the high impedance, low impedance in the ovary and also in the uterine. We can evaluate the uterine artery is having low impedance or high impedance. We will discuss those things. Okay, now let me give the last part of the outline of the Doppler in the pelvis. That is to evaluate the pelvic pathology. To evaluate the pelvic pathology, what are those pathologies we like to see? Okay, ovarian functions, we need to see the resistivity index by doing the Doppler Webb's parameter, Webb's evaluation. We can figure it out, is the ovary is doing the normal functions or not according to the ovarian cycle based on the LMP. And ovarian tumors, to see the resistivity index, as we know that the malignant tumor has too much blood flow to the tumor and its resistivity index is low. That's why the blood is moving from higher pressure to the lower pressure. More the vascularity in one area, that means the resistance to have the flow to that tumor or organ is low. That means impedance or resistivity index is low. That's why the blood is moving from higher pressure to lower pressure. So ovarian tumor, we discussed before, a lot of ovarian tumors, and if we see the ovarian tumor artery resistivity index is low, so then we can figure it out that it could be malignant. We also like to see the ovarian torsion. Torsion means twisting of the ovary along with its suspensory ligament. Okay? Ovary is hanged by the ovarian ligament, and ovary is also hanged by a suspensory ligament through which the ovarian artery, the vein, they are passing through, and if it is torsioned, it will be twisted and the vein will be obstructed first, then artery, the nerve and also lymphatics at the beginning. So then as a result, the ovary within, if it is not set by 8 hours, it could be dead. Okay? With a Doppler for the ovarian torsion, we can figure it out what are the causes of this ovarian torsion. Keep that in mind. Normally ovary does not get torsion unless the ovary is heavy, too much, too big. So now we need to understand what causes this ovary is heavy. Maybe there is a hemorrhage inside. Maybe there is a multiple tumor like a polycystic ovarian diseases. Or it could be hyperstimulated during the trial of the in vitro fertilization, ovulation induction. Okay? So in that condition, ovary is hanging down with the suspensory ligament and it can be twisted anytime. Okay? And we also need to evaluate flow is there, some flow is there, or no flow is there in the ovary by the Doppler. We also want to evaluate the ectopic pregnancy or the placentation. Ectopic pregnancy, as we know that in normal IUP, intrauterine pregnancy, normal, there is a double decidual sac sign around the gestational sac. And if you click the color, you will see the more vascularity around the gestational sac. And again, if there is a fetal pole appearance, we can see the motion of the heart. Even though if you click color, you can be confirmed that it is a live or dead embryo within the gestational sac when you suspect that this is a ectopic. Okay? So that time you can figure it out, is it really an ectopic pregnancy or not? Doppler is very important to identify the ectopic pregnancy, live or dead. Then placentation. The sonographic appearance of the placental tissue, we can figure it out by 8 weeks. And gradually it grows more and its echogenicity gets more and more, and by 10 to 12 weeks we can really figure it out. Okay, this is the placenta. And we click the color, we see the more vascularity over there than the other part of the uterus. So we figure it out that this is a placenta. And moreover, we can see the umbilical cord, 8-9 weeks. We can figure it out that the placental end of the umbilical cord, if you click color, you can see the color flow. Okay, so it can be very helpful. The next one is the written product of conception. Written product in conception, mostly it is the early placental tissue and yolk sac and some other, could be some umbilical cord structures. These are written product, and with the blood and blood clot. In incomplete abortion or partial abortion, the fetus or the embryo is in the process of going out. Patient may complain, okay, I pass a blood clot and I pass these structures, these are the, I don't know what is this. Then you need to do the sonographic checkup of the endometrium. Why? Because the endometrium may have the written placental tissue inside and it's bleeding. And the thickness of the endometrium will be bigger. So if you click the color, then you will see lot of fluid maybe inside the uterine cavity, or there might be no fluid, but in endometrial thickness is bigger. Click the color, then you will see it is hypervascular. That means it is the endometrial placental retention, embryonic placental retention within the endometrium. And then they send the patient for DNC, and the patient will go home. Okay? If patient is not diagnosed that there is a retained product of conception, patient may have infection. Patient may come to the hospital with infection, foul smell, patient is really sick, high fever, and patient is really sick. Another one is pseudo-sac evaluation. Pseudo is false gestational sac evaluation. Pseudo gestational sac, they don't have the double decidual sac sign, because double decidual sac sign comes from the decidua capsularis and parietalis fusion together. And if it is a pseudo gestational sac, how come those decidualization take place? And mostly it is there is no hypervascularity activities or normal vascular activities around the gestational sac. There might be normal, but this is a pseudo gestational sac. Why there is a pseudo gestational sac? Because the ectopic pregnancy, most of the time ectopic pregnancy is there, maybe in the fallopian tube, and uterus didn't get the pregnancy, but uterus has an endometrium that was waiting for the pregnancy. And because of the ectopic pregnancy, there is trophoblastic activities, and the beta HCG hormone will be increased gradually, and it comes in the blood, and blood comes into the endometrium, and endometrium has a reactive more secretion of the fluid that accumulates inside the uterine cavity, and it looks like a gestational sac, but it's not round, not oval, it could be elongated. And you might be confused that, oh, I see the echogenic ring around it, but it is not double decidual sac reaction. It is not. It is the endometrium around it. But this collection of fluid is tubular shape, okay, elongated form. But pregnancy test will be positive because of the ectopic pregnancy. Okay, so that's the way people may get confusion. And we need to click the color in the uterus to see the hypervascular activity around the gestational sac. So we can figure it out. It is a true sac or pseudo sac. Then fibroid. What is fibroid? Fibroid is a benign solid tumor in the uterus. Benign solid tumor. And it is formed by the fibrous tissue and the muscular tissue. And the fibroid usually is a growing fibroid. It has a hypervascularity. Usually it has hypervascularity, and we need to click to see is there any feeding artery going towards the fibroid. It is needed. And you also need that to kill the fibroid, to stop the nutrition or blood flow to the fibroid, there is a procedure called embolization, microbubble embolization. They induced or introduced the foam, there is a micro bubble, into the feeding artery with the guidance of ultrasound and the Doppler application. And they inject that foam and the blood flow will be shut down, and gradually the tumor will be regressing and compromised. It depends on the type of tumor. If it is a malignant type of tumor, the malignant cell, they don't care. They said, you stop one supply, I am making my own blood vessels connecting to the other sources. I'm going to get the blood flow. Okay? But still, it is in benign fibroid, it is a very good practice nowadays to many hospitals. The molar pregnancies. In the molar pregnancy or hydatid deformed mole, it is a gestational trophoblastic disease. All gestational trophoblastic tissues are hypervascular. They are hyperactive. They produce beta HCG. And initially they keep the pregnancy stable, alive. And molar pregnancy is when there is no true pregnancy in the uterus. Instead of growing the fetal pole, yolk sac, and the normal placenta, the whole gestational sac is filled in with the chorionic villi, abnormal shape or forms of the chorionic villi. Usually it looks like a grape, bunch of grapes. And it sonographically, it is anechoic, just like a honeycomb with the echogenic walls. And it is hypervascular. If you click the color, then you will see the whole mass is hypervascular. And there is no other sign of pregnancy, means the no fetus, no embryo, no yolk sac. So it could be coexistence of the normal pregnancy one and one pregnancy at the same time in the uterus is molar pregnancy. There is a twin pregnancy, one could be the normal, another could be the molar pregnancy. So we need to click the color. We also need to click the color if the molar pregnancy is treated. And we need to see the progress of the treatment, prognosis of the treatment. Is the treatment is working or not? So we need to click the color in molar pregnancy. Okay, and you know that some molar tissue, gestational trophoblastic disease, could be like a choriocarcinoma. It can invade through the uterus to the other organ, even though that can go to the lungs. So when it gets metastasized or invading, so we need to click the color to see the vascularity.